Good morning, everyone. I am Ernesto Burden. I'm the publisher of New Hampshire Business Review, and it's my pleasure to welcome you today to our webinar on how employers can keep healthcare costs under control while maintaining high-level care. This is a tremendously important topic, as anybody who has had to manage a business's budget knows. Our presentation today is sponsored by UnitedHealthcare, and we will be talking the presentation will be a conversation between myself and next slide, Caitlin McCormick, Vice President of Sales and Account Management for New England for UnitedHealthcare. So let's bring Caitlin in.
Good morning.
Hi, Caitlin. How are you?
Good, thank you. How are you?
I'm doing well. Thanks for joining us.
Thanks for having me.
So let's dive right in. Like I was saying, and I guess I was thinking back to over 20 years in the business that I'm in. Healthcare costs have a huge impact on a business's bottom line, on what you're doing when you're creating a budget at the beginning of the year, and it's probably one of the key inflationary points that is a pain point for budget managers. So what are you seeing in terms of high level trends, both positive and challenging, maybe in the industry overall?
Yeah, sure. So you're absolutely right, Ernesto. I mean, aside from payroll, healthcare expenses rank among employers' top costs, and it's certainly an area that we feel very passionately about, controlling the overall cost of care. Some of the key trends that we see is certainly coming out of the pandemic, a return to care, right? So we had people who maybe didn't get services for a year or two, either for fear of going into a hospital or a provider group building, or just not being able to get appointments with the way that the pandemic unfolded. So certainly employers are facing a situation now where they're trying to make sure their employees have the benefits that they need and they deserve, to be able to re-engage with the healthcare system and be able to navigate in this post-pandemic environment.
How do you have a sense of what some of that delayed care did in terms of patient populations and health outcomes?
Yeah, I mean, as we sit down with clients, certainly we see that, in some cases, things like routine screenings, cancer screenings, things of that nature may have been missed for a year or two. So we're seeing a return to those screenings, which is great, right? We want people going and getting their preventive care and engaging with their primary care physicians. Certainly we have seen, unfortunately, in some areas, things cropping up, sort of conditions that, maybe weren't screened for a couple of years that are now cropping up. And that's where we're really working with our clients to make sure that people are getting back to those screenings and catching those things as early as they can.
What would you say some of your clients' biggest pain points are? What do you hear the most right now in terms of help?
Yeah, so certainly among the top is cost, like we just talked about, needing sustainable plans that over time can help bring the cost of care down, not just shifting more cost onto their employers. And I have a couple of strategies that I can share specifically that we're, really talking about in the market. I think the other piece is access to care, right? So UnitedHealth Group has the unique privilege to be not only an insurance company, but a provider group in many of the areas where we serve. And so, we're really focused on making sure that everyone across New Hampshire and across the country has access to really quality, affordable healthcare. Certainly our hospital systems and our provider partners have been challenged over the last 2 years. And so maintaining and growing that access is of utmost importance to our clients and to us.
Can you talk a little bit more about that structure of being both an insurance company and a provider group? Like, how does that work, and how is it different from the way things are usually structured?
Sure. So we, UnitedHealth Group owns both UnitedHealthcare and Optum, and a part of Optum is Optum Care, which is provider groups that are growing across the country. We don't have any specifically in New Hampshire right now, but we do have some just over the border in Massachusetts. With our acquisition of Surest last year and Reliant Medical Group a couple of years before that. So for example, in Massachusetts, we're working on a joint product between us and Optum Care that would allow for a unique experience for members. And I think you'll see more and more of that from us across the country, hopefully, at some point in New Hampshire as well.
So some of the things that you guys are working on, we talked a little bit in the preparation about taking a direct approach to cutting costs with personalization. Can you talk a little bit about what that means?
Yeah, absolutely. So we are really excited about a new product that is launching for 7/1 called Surest. And actually, I will share my screen and show you a little bit of what that looks like here. Can you see that okay?
Yes.
Okay, great. So one of the biggest sort of challenges for members and employers alike is, we've all focused for a long time on these high deductible plans, right? Shifting costs onto employees, asking them to pay a deductible. But that's simply not sustainable when you think about, the average worker across the state or even across the country. Asking someone who makes, say, $50,000 or $60,000 to pay a $6,000 deductible or a $5,000 deductible before they really have any coverage, that's just simply not insurance, right? That people don't see the value in that, and they shouldn't see the value in that. So we are really excited that as of 7/1, we're launching a plan called Surest, which eliminates deductibles and coinsurance. If you ask the average American to do, an exercise that, an elementary school child might do with simple terms, if you ask them to do that with deductibles or out-of-pocket maximums or coinsurance, here's the term on the left and here's the definition on the right, only 1 in 4 Americans could accurately match up those terms. Yet we ask people to become experts on their healthcare and become consumers of healthcare, and utilize terms like that every single day while, owing quite a bit of money up front. So Surest is a plan that will save on average about 14% versus actuarially like plans on the market. And it will also lower out-of-pocket costs for members by up to 46%. And I'll show you a little bit as to why that is, if I can get this into slideshow mode. So if you look at a plan design, for instance, that has a $2,000 deductible and 80% coinsurance, right? I think we can agree that's a pretty standard plan with a $4,000 out-of-pocket maximum. If a member seeks care and they have a choice between 2 different hospitals, one hospital might be charging $12,000 for a claim, and the other hospital for the same service might be charging $80,000, right? There's a lot of differentiation in price when consumers are out in the market trying to find care. If they're on that traditional $2,000 plan, that member's responsibility is the $2,000. Then they pay coinsurance up until they're out of pocket. The plan in that scenario with that $12,000 service is going to pay $8,300. Under hospital 2, that member is going to have that exact same liability, but the plan is going to pay $76,000. So there's really no incentive for a member on a plan that's already complex and they're trying to figure out to go to hospital 1 over hospital 2. There's a $68,000 difference though for the plan. So how does Surest work? Surest gives flat copays for episodes of care based on quality outcomes. So if we can get members using the high quality providers that we want them to use because we know they're going to have a better health outcome and therefore drive lower costs for the plan, they're going to pay a lower copay. And as a result, they're going to be driven to use the system that's going to have an overall lower cost of care. Not that the care for that individual procedure is necessarily cheaper, but the total cost for that overall episode is going to be less expensive because the member is going to have a better outcome. So the member gets the benefit of that very simple plan design, and they get the benefit of a better health outcome, and the plan gets the benefit of that savings.
And how does that benefit savings translate for say the employer, in terms of, what they're looking at the end of the year?
Yeah, that's a great question. So in this example, if this client were to go with a Surest plan versus the plan I compared to, that plan will save them up to 15% on their premiums, all based on those better health outcomes. We can price those plans much more competitively because we're driving members to that better care.
And maybe can we define a key term too for the listeners and for me? What are better health outcomes? Like how is that defined?
Sure, that's a great question. So think about someone who's going to the doctor for knee pain, right? They go into the doctor for knee pain, and you might have doctor one who says, hey, we need to do a knee replacement. We need to get you right in. We need to do the knee replacement. You might have that knee replacement. It didn't work. You have to have it redone. That overall cost of that episode is one, expensive, but two, that's not good for the member, right? Maybe they didn't need that knee surgery at all. And if they did, certainly they didn't need for it to have to be done twice. But think about Dr. B on the other end of the spectrum, who might say, hey, let's try physical therapy first. Let's try some pain management first. And so maybe that member never gets to need the knee surgery, which certainly would be a better health outcome for them if they can get the benefit of their knee feeling better without the replacement. But let's say then that same Dr. B says, physical therapy didn't work, pain management didn't work. You do need the knee replacement, but it's done right the first time. Again, that overall episode of care is still lower than Dr. A, and the member benefits from not having to go through two surgeries.
Okay, well, so this encouragement of you also part of this is, I guess, creating some transparency around what all of these things cost for the healthcare consumer, and how does this do that?
Yeah, that's exactly right, Ernesto. So Surest is driven completely by an app. Certainly it can be accessed via a website, and there's still a telephone number to call, but the member has all of the decisions that they need to make right in the palm of their hand. I think that we as an industry have called upon members to be good consumers, but until this moment, we really have not given them the tools that they need to actually do that. You can find more information when you go out and buy a TV than you can when you go out and select a doctor in many cases. And so Surest is really driven by those copays. You go onto the app in plain terms, you type in the service that you're looking to have. Like, let's say you're having a baby, or you have sinus pain, you type that into the app and it will come up and give you your options for care with the associated copay. So the member is driven to the lower copays by having them show up first, but we're maintaining that choice, that national access that we're known for. And at the end of the day, it's up to the member to make that decision. But we have heard very real examples from members who have been seeing providers that they were disappointed to learn how to higher cost share. And when they switched to a provider that had a lower cost share due to their outcomes, they saw better health results as a result. And that's, at the end of the day, that's what we're all looking for, right?
Absolutely. Well, it seems like, I mean, broadly, and I, just anecdotally, over the past, I should ask the question, not make a statement. How long has it been since that push for transparency of cost of care has really been going on in terms of trying to empower people to make these decisions themselves, or to make good choices around costs? Because it seems like, as you showed, the same service might cost $12,000 or $80,000, depending on where you go. And that's pretty dramatic.
Yeah, I mean, I would say transparency has been called upon since HSA plans came to the market, which was, I don't know, probably 15 to 20 years ago. And healthcare really there hasn't been another big invention in healthcare since that time. And we think Surest is that next moment that, the transparency becomes embedded in the plan and required in the plan, as opposed to asking members to go out and find the information themselves.
I'm pleased that my memory still works, in that was, I was going to say, about 15 years ago, I remember being, having that be the message during, your employee orientation around your new healthcare plan. But then going into doctor's offices and asking, well, how much is this going to cost, when they suggested you get something done, and nobody could tell you. And it feels like now it's better, like there is more of but you still have to ask the question. So this sort of even takes the need to go in and do a bunch of detective work away.
Exactly. And we certainly believe that HSA plans and high deductible plans still have a place in the healthcare system. If you think about high earning employees who are looking for a savings vehicle, there is no better healthcare savings vehicle than a health savings account. So we're not calling for those types of plans to disappear. We'll continue to deploy them as part of an employer's overall strategy. But if you think about, the average wage earner or someone who's not as interested in using the HSA as a savings vehicle, and maybe is just using it year over year to pay their in-year costs, something like Surest becomes a much more attractive option. Less than 1% of members on a Surest plan ever hit their out-of-pocket maximum. And so, unless you're really wanting that HSA to be used as part of your financial planning strategy, this is certainly something that I think every employer should be considering.
Now, before we move on from Surest, I see you have one more slide. What's the?
Oh, sure. So, those on the phone might be wondering, what does this plan design look like and how does it actually work? So if you go back to that same $2,000 deductible that I mentioned a couple of slides ago and showed you how you might select a provider based on the copays in the Surest plan, this is an example of how that plan design works, right? So you have the $2,000 current plan with the out-of-pocket maximum of $4,000. We might compare that to our Surest C5000 plan. What does that mean? It means a range of copays. So if you look at something like maternity, for instance, you're going to pay between $900 and $1,700 out of pocket. If you look at physical therapy, it's going to range from $10 to $70. Again, going back to that app and which provider you select. But I think what's really compelling is on the right side of this page. I think we could all agree that in a year where your family might have a baby, get a sinus infection, go for an MRI, and need a knee arthroscopy, that's a pretty significant, health event year. And in that plan, in the current plan, the traditional plan that you might be on, I think we could all agree that you're probably going to hit that out-of-pocket maximum. What this illustrates here is even in a year that has that higher utilization than normal, you're going to stay well below your out-of-pocket maximum through this copay-based approach. So I think this really makes it real for members, how they might take the plan structure that they're used to and imagine what healthcare could look like with Surest.
Well, thank you. And we do have a question in the Q&A, and this is a perfect time for me to remind everybody who's listening that you can ask questions in the Q&A, and I do not have to be the only one who gets the privilege of asking questions. So let me give you this one because it's related to Surest. The attendee asks, Surest is currently for groups of 51 plus. Is that correct? And only certain brokers are certified to sell the product?
Sure. So yes, we are filed in New Hampshire to sell Surest as of 7/1 effective dates for business that is 51 plus. And yes, we recently had a broker certification program where we asked brokers who wanted to sell the product to come and be certified. And so those who are able to work with us to distribute our new product.
Follow-up question from another attendee, just as to how doctors' offices are responding to the plan.
Yeah, I mean, under our contracts with our providers, we certainly were transparent about the launch of this product. And New Hampshire is not the first state we've gone live with Surest, so we were filed in 30 states around the country. And the response from the provider community has been just fine.
Well, excellent. What moving from Surest, what are some of the other things that you're doing? And we can even be broad and say even industry trends, but especially you guys, as we're talking to you, what are some other things that people are doing to sort of save money for consumers or employers?
Sure. So I think another area that we're really focused on, and I think the industry overall, should be thinking about, is the area of prior authorizations. I think especially coming out of the pandemic, doctors' offices are overwhelmed, right? So the need to go and administer the prior auth process becomes burdensome, and ends up sort of putting the member in the middle of all that. So we recently announced that this summer we will reduce the overall volume of our prior auths by 20%, allowing members to have easier access to care. And we're doing that. Prior auths can be a very good thing, right? They oftentimes, I mean, at the crux of how they work, they protect patient outcomes, right? If you go to a doctor and there's a procedure that maybe you shouldn't have, you want someone saying, hey, I'm not sure this is the best approach for you. But we're able to work, we're able to look at across our business, across our data and say, these procedures are overturned 90% of the time. Why are we requiring a prior authorization? So we're implementing that across the board. And then we're working with certain provider groups to do something called gold carding, which is, for providers that we can really trust. They've showed us time and time again that they do the right things, not requiring that same prior auth onus on those providers. So I think that's definitely another trend we're seeing to improve access, but also improve affordability.
Do you have a sense of what some of those specific kind of procedures are that are currently require authorization, but probably shouldn't? Or is that getting too
No, that's okay. I don't have the exact list in front of me, but I certainly could follow up with you with more of that information.
Okay. One of the things that's a big topic, I think, nationally on a social level is healthcare inequity. And you and I, when we were talking about this ahead of time, spoke about this a good deal. I mean, maybe can you give a general sense of that? That is a problem, like overall in the country right now, and then maybe a look at what folks are doing to combat that.
Yeah, absolutely. It's certainly an issue. And I think for many of us, right, when we've thought about healthcare inequities or social determinants of health, you sometimes think of that as an individual exchange issue or a Medicaid issue, and it's such a commercial issue. Within, so many health plans, pretty much every health plan we look at now, there are people with food insecurities, housing insecurities, certainly financial insecurities. And so how do you ask someone who's focused on feeding their family or making the decision between paying an oil bill and paying their deductible? How do you ask them to really focus on their health plan and make a good decision? That's certainly one big reason why we're launching Surest, but it's also a reason that we are looking at across a lot of other areas of our business. Another big area is advocacy. So when our advocates pick up the phone and talk to a member who calls into customer service, they can see social determinant of health information on the screen. So they can tell if a member might have a food or housing insecurity, certainly not with 100% accuracy, but through the data that we have both internally and the external data that we use. And they can connect members with either internal resources or even resources in the community that may be able to help them in a very discreet and appropriate way. But again, helping that member at the time when they call us, even if it's a simple question like, hey, I need an ID card, linking them up with a resource that they may not know that they needed or had. Taking that a step further, we've learned a lot about advocacy over the 10 years or so that we've been focused on it. And in 2020, we actually launched our special needs initiative. 1 in 5 children in the United States have a special healthcare need, and those families of those children interact with the healthcare system on average 12 times more than the other 4 out of 5 families. And that's so hard, right? If you think about a parent who's trying to advocate for their child, and where do they go? The healthcare bills are piling up. And so we saw a need for that program. Candidly, we saw it from an executive at UHG who had a child with special needs who said, if I can't figure this out, how can we ask our average consumer to figure it out? And so we actually align every family who has a child with a special needs with a one-to-one advisor who works with them on an ongoing basis so that they don't have to call in, tell their story over and over again. And it really allows that advocate to work on that member's behalf, to help them sort through everything, to be a resource for them, again, with programs within United Health Group, but also in the community. And we've seen such a benefit from doing this. We've seen these families really go from having a poor experience with the healthcare system to saying, you know what, I really like my health plan. I really value my health plan. I would be upset if my employer got rid of my health plan. And so to us, that's a really big deal.
That program, when did that launch?
In 2020.
2020. And so that's enough time to have seen some data accumulate on
Exactly.
Of it. Do you have a sense of how much time that might save parents, just in terms of not having to tell the story again and again?
Yeah, absolutely. From what we hear from parents, it saves them a lot of time, hours every week. We've heard from families who went from having to have a binder on the kitchen table that they went through every night thinking about bills and appointments to just having a check-in with their advocate, their personal advocate, who could really help them get in touch with their doctors and really be that conduit to the overall system. So much so that we're taking the learnings from that program and applying them to other high need populations. So people who are going through gender affirming services, we know that they interact with the healthcare system at an increased rate as well, and might have very unique questions and concerns. And so we're connecting them up with these designated advocates as well. Same with adults with complex conditions. So we're really taking our base advocacy services that apply to every member on our book and trying to hone in on the unique needs of certain populations who might need a little bit of extra help, and where we can really make a difference for them.
Okay, we did have another question from the audience, and it was backing up a little bit. You had mentioned something that was currently not available in New Hampshire, but was available in Mass. And I think that was when you were talking about the alignment of your provider services with your insurance. Is that right?
Yeah, I was just saying that Optum Care is our sort of arm that owns some provider groups across the country, and we don't currently own any in New Hampshire, but we do in Massachusetts.
Do you see that as something that's a plan for expansion down the road?
I think on our, national roadmap, it's a priority. I don't know specifically. I don't think we have anything identified in New Hampshire on the immediate horizon, but it's certainly something as we think about, our national business plan as an organization. It's an area of growth for us.
Okay. Another issue that comes up around healthcare equity is healthcare in rural areas where people don't have access to physicians, where there might be, or to medical services, that there might be physician shortages, nursing shortages, transportation issues, and you guys are doing things with virtual care to try and address that. Do you want to talk a little bit about that?
Sure. So if there was one advantage that came out of the pandemic, it was that we went from meeting with clients and saying, congratulations, your employees used 10 virtual visits this year to, congratulations, your employees used 2,000 virtual visits this year. The pandemic really across the country and across New Hampshire very much accelerated the use and the demand for virtual care. And we were very fortunate to be in a position right out of the gate in 2020 to offer virtual visits on a 24/7 urgent care basis. We also offer primary care virtual visits. So you can see a virtual primary care physician, which I think, especially in a rural area or where provider choice is lower, there's a shortage of PCPs. There's a lot of even primary care that can be delivered virtually. And then one of the biggest areas of focus and frankly, where a lot of the demand is coming from is in the behavioral health space. And we're so fortunate that Optum Behavioral Health has the largest telemental health network in the country, meaning that, members could see on an ongoing basis, they could have an ongoing relationship with a virtual, behavioral health provider. So not just to be used in an urgent situation, but actually be able to see that same provider over and over again. And now that people are sort of back to in-person care, we're seeing situations where sometimes people might see that behavioral health provider in person, and then the next week they might choose to see them virtually. So it allows, members to have that nimbleness in their schedule and really be able to get the care that works for them when it works for them.
Are people utilizing, thinking behavioral health, but it could be a broader question as well. Are they utilizing those? How wide of a net might they have? Might they be able to talk to somebody who they'd never be able to drive to see, for example?
Certainly. Yeah. I mean, you have to obviously be mindful of the licensure requirements by state and make sure that, we would only connect a member with, say, a New Hampshire member with a physician who's licensed in the state. But certainly in the rural areas where you might live in the northern part of the state and be seeing someone in the southern part of the state, that's absolutely expanded access. And I think, as an industry, we talk about the behavioral health crisis that we're all facing, right? Just as a country right now. And, we're happy to be able to say that we are able to connect people with the services that they need within a matter of days rather than weeks. And that really matters, right? If you're thinking about, whether it be an adult or an adolescent, a child going through a behavioral health situation, the time to care really matters.
We have a question related to this very topic.
Great.
We live in New Hampshire. My son's neurologist is at Mass General in Boston. Can he do a televisit?
So it would depend on whether that doctor can see patients in New Hampshire. It would depend on their licensure. In many cases, yes, but I wouldn't know the specifics around that, but I'm certainly happy to follow up with that individual if that's helpful.
Okay, but in general, it's possible as long as the doctor has that licensure. Is that becoming a trend where doctors might want to become licensed in more states in order to be able to accommodate telehealth?
Yeah, they certainly might, because I think, to your point, I think it's becoming a convenience thing too, to even outside of the behavioral health space. That doctor in Boston might say, I saw you in person, we need to do a check-in, we could do that virtually. So again, it would just get down to their individual credentials.
Okay, and I have something else in my notes here that I think is worth touching on relative to virtual care, which is I think it's easy to imagine some uses of it, in particular behavioral health, where you're having a conversation, potentially. But people also seek virtual care for things like back, joint, and muscle care. Can you say a little bit about that? Like how, this feels like an expansion of what virtual care was when it first sort of launched.
Yeah, absolutely. So through partnerships that we have with organizations like Hinge and Kaya, members are able to do things like virtual physical therapy or stretching right through an app. So, you might be meeting with someone in person. You also might be going through a module where the screen is directing your movement. And again, similar to behavioral health care that you might have to go for weekly, the physical therapies are similar to that, right? You might have to go to PT twice a week. Well, if you could do some of those exercises on a virtual basis and have confidence that you're doing them correctly, that can really make a difference in your care path.
On the continuing on the topic of health inequity and social determinants of health, you mentioned some of the factors earlier that were related to, or that could be related to this, like food insecurity, housing issues, and UnitedHealthcare is working on addressing housing insecurity. How is that? How is that happening, and how is that sort of, how does that relate to the overall mission of, insurance?
Sure. Yeah. So our mission at UnitedHealthcare is to help people live healthier lives, whatever that means. Certainly, we do that through a lot of different avenues. One avenue is, through administering benefit plans. And we know that 80% of a person's health is impacted by what happens outside of their doctor's office. And in fact, I think the latest stat says that your zip code has more to do with your health outcomes than your DNA code does. So if that doesn't tell you something about, what we're facing from an equity perspective, I don't know what does. But what we do is when we're screening for these types of conditions, or these types of inequities, we're making connections in the community. So whether it be, working with a local food bank to connect someone, or bringing fresh food to more communities who are in need, by making investments in those communities. So outside of our direct, client relationships, we're doing those things in the community.
Okay. What are some of the things that United is doing it would fall under the category of innovation? We've talked a little bit about technology in terms of the app, but there are other things, right, that sort of also are really technology innovations.
Yeah, absolutely. So we at United Health Group spend $5 billion every single year on innovation, right? Thinking about what's the next big thing in healthcare, what is the technology and the research that's needed to drive that next big thing. I talked about Surest. That's a huge example of, what comes out of that investment every year. But there are other pieces to your point. So UHC Rewards is a new interactive wellness program. It's a no-cost experience that gives members financial rewards for reaching goals, and by completing, either ongoing or one-time activities like walking, getting better sleep. Members can use a device to track their activities, set goals, and receive those rewards. So I think that's one example. We also have our Rally website and mobile app, which is another thing that came out of our, innovation arm. And that really, again, helps members, do everything from getting more active to eating better. So, we're always thinking about, what is that next big thing that's on the horizon.
That feels a little bit like the gamification of,
Yeah.
of some of these tasks to sort of create the same sort of incentive that people have with other things that may be less productive that they're doing on their phones right now. Not making judgments, but
No, absolutely, that's true. And, that technology investment doesn't stop at the member level. It extends to the provider as well. So, if you think about what is the number one thing that makes a member most frustrated, having worked here for 10 years, I would say it's showing up to the pharmacy at 4 o'clock on a Friday and not being able to get the medication that was prescribed to them that afternoon at their doctor's appointment, before the weekend. So we've actually put technology in providers' hands that integrates right into their electronic medical record system so that when they go to submit a prescription to the pharmacy, for instance, they get a pop-up that says this drug is excluded, this drug has a lower cost alternative, this drug requires a prior authorization. 96% of pharmacy claims run through no problem, but it's that 4% that don't, that always are on Friday afternoons, I can tell you, usually before a long weekend. Those are the ones that really that are noisy and that provide a poor experience for that member. So by being able to communicate directly with the provider in the software that they're already using without a separate login, it's such a different experience when that provider can either make a different decision at point of prescribing or choose to send us the information that we might need to approve the original drug they were trying to prescribe so the member doesn't land in that situation.
I mean, it seems like so much of this transformation is, partly driven by folks like you who are working on this problem from a consumer side, and then also from the core technologies themselves as they continue to evolve. And that evolution seems to be happening so quickly. How do you as a company look ahead and say, this is where we're going to go in the future? Do you have some things that you see potentially as developments coming down the road?
Yeah, I mean, I feel so fortunate to have such a wide array of very smart colleagues across the UnitedHealthcare enterprise. I think that's such an advantage to working here is that investment that we make in innovation, right? We're a large national company that delivers care very locally. So we're very much in the markets we serve, such as New Hampshire. But we have sort of this bigger enterprise around us that allows us to do the outlook at these bigger trends. I would say prescription drugs continue to be an evolving trend and something that we're looking at very real time. We launched earlier this year $0 copay for vital medications. So we eliminated out-of-pocket costs for things like insulin, epinephrine, glucagon. The higher prices on many of those drugs were a barrier for people. And so we're able to shield people from those prices by the pharmaceutical companies by giving them those $0 vital medications. I know as an enterprise, we're also very focused on some of the emerging pipeline of drugs, right? The gene therapies that are coming that are going to be life-changing, but come at a very high price point. And also the widely advertised weight loss medications. We're actively working on our position on those and how are we going to make an impact in a drug class that's going to be widely applicable to a big portion of the US population will be eligible for. And at the moment, they're at a very high price point. So those are some of the things we're thinking about and innovating around moving forward.
How do you do a $0 copay for vital medications? And what are some of the ways? I mean, that feels like a way that you're applying pressure to control drug costs. How do you do that?
Yeah, so we certainly work with the drug manufacturers to negotiate, what we pay for drugs, but we also, we have the unique opportunity as the health insurance carrier and the prescription drug manager to look across the overall cost of care, right? So we know that if we're going to pay a little bit more to give a member a $0 cost share on, say, their insulin, they're going to have a better health outcome and stay out of the hospital. And so for us, that's a win, right? It's a financial win. It's also a member outcome win. And so we're able to do those things because we can look across the whole system because we're involved in both sides.
That makes a lot of sense. And certainly it seems like preferable for the member to have that better outcome rather than end up having expensive treatments after the fact. So
we certainly think so.
So, Caitlin, what haven't I asked about that we should cover? I feel like we've covered a ton of ground here in almost 45 minutes. So, but I don't want to leave the conversation without checking in to make sure that we haven't missed anything.
And I think we have covered most of it, Ernesto, most of what we talked about in our prep, certainly. I guess, we just want people to understand that we're here, we're local. We have more than 600 employees across the state of New Hampshire. So we talked a lot about, our big ideas and big innovations and our new products coming to the market. But we're delivering all of those things in a very local way. So we're very excited about the opportunity that lies ahead in New Hampshire specifically. And I'm happy to answer questions that anyone here might have today or as a follow-up to this discussion.
Wonderful. Well, thank you. We don't currently have any more audience questions open. We answered them all. So with that, I will thank you for joining us for this conversation. Thank UnitedHealthcare for sponsoring this, and thank our audience for being here with us this morning. Thank you all. Caitlin, what a pleasure.
Thank you. It's always a pleasure, Ernesto.
Be well, everyone. I'm Ernesto Burden. Thanks very much.